It's late. You're finally drifting off to sleep. Then a sharp cramp seizes your calf, or a persistent ache throbs in your thighs. You get up, walk it off, maybe rub it, and it fades. You think it's just a Charlie horse, or maybe you overdid it today. But what if this nightly discomfort isn't just muscle fatigue? What if it's your body sending a critical warning? A whisper of a serious condition affecting millions, often ignored until it's too late. It's time to listen closely, because this leg pain at night might be more than just a nuisance. It might be peripheral artery disease. Let's talk about that pain. It's often described as a cramping, aching, or tiredness in the leg or hip, especially during physical activity, and can worsen at night. This is a classic symptom of peripheral artery disease, or PAD. So, what exactly is PAD? Simply put, it's a common circulatory problem where narrowed arteries reduce blood flow to your limbs, most commonly your legs. Think of your arteries as pipes carrying vital oxygen and nutrient-rich blood from your heart to every part of your body. With PAD, these pipes become hardened and narrowed due to a buildup of fatty plaque, a process called atherosclerosis. Imagine a garden hose slowly getting clogged with sediment. The water flow diminishes, and eventually the plants don't get enough nourishment. Similarly, when the arteries in your legs become clogged, your leg muscles and tissues don't receive enough blood supply. This oxygen deprivation causes pain and discomfort, particularly when your muscles are working harder, like during walking or exercise, or when you're lying down at night. PAD is often overlooked or mistaken for other conditions like sciatica, arthritis, or just aging pains. But ignoring it can be dangerous. It's a progressive disease, meaning it tends to get worse over time. And it's not just a leg problem. It's a sign of widespread arterial disease, putting you at a much higher risk for more serious cardiovascular events like heart attack and stroke. So that nightly leg pain isn't just about your legs. It's a silent alarm from your entire circulatory system. While leg pain or claudication is the most common symptom of PAD, it's crucial to understand the full spectrum of signs. Importantly, many people with PAD have mild or no symptoms, which makes it even more insidious. But for those who do experience discomfort, it often follows a distinct pattern. Classic symptoms of PAD, especially in the legs. Claudication, muscle pain or cramping in the legs or hips that occurs during activity, like walking or climbing stairs, and resolves after a few minutes of rest. The location of the pain depends on where the artery is narrowed. Calf pain is very common. Nighttime leg pain, rest pain. This is often a sign of more advanced PAD. The pain occurs even when you're at rest, especially when lying flat at night. Gravity normally helps blood flow, but when lying down, the leg is at the same level as the heart, further reducing blood supply. Dangling your leg off the bed or getting up to walk around might temporarily relieve it. Numbness or weakness. A feeling of numbness, weakness, or heaviness in the legs or feet. Coldness. One leg or foot feels significantly colder than the other. Sores that don't heal. Sores, ulcers, or wounds on the toes, feet, or legs that heal very slowly, or not at all. This is a serious sign of severely restricted blood flow. Change in skin color. Discoloration of the legs or feet, often appearing pale, bluish, or reddish. Hair loss. Loss of hair on the legs or feet. Slowed nail growth. Toenails may grow more slowly or appear brittle. Shiny skin. The skin on the legs may appear thin, shiny, and stretched. Weak or absent pulses. A weakened or absent pulse in the legs or feet, which a doctor can detect. Who is at risk? The key risk factors for PAD. PAD is primarily a disease of atherosclerosis, meaning the risk factors are very similar to those for heart disease and stroke. Age. The risk of PAD increases significantly with age, especially after 50. Smoking. This is the single most significant risk factor for PAD. Smoking damages blood vessels, accelerates atherosclerosis, and drastically worsens PAD symptoms. Even former smokers are at higher risk. Diabetes. High blood sugar levels damage blood vessels throughout the body, making diabetics 4 times more likely to develop PAD and experience more severe symptoms. High blood pressure, hypertension. Uncontrolled high blood pressure puts extra strain on artery walls, contributing to plaque buildup. High cholesterol, dyslipidemia. High levels of LDL, bad cholesterol. Ignoring that nagging leg pain, those cold feet, or the difficulty walking can have severe, even life-altering consequences. PAD is not static. It's a progressive disease, and without intervention, its trajectory is often grim. The plaque continues to build, the arteries narrow further, and the blood flow becomes more critically impaired. Here's what happens when PAD is left untreated. 1. Critical limb ischemia. This is the most severe form of PAD, occurring when blood flow to the limb is so severely restricted that it cannot even meet the basic metabolic needs of the tissue at rest. CLI causes constant, excruciating pain, even when you're not moving. This is the rest pain that might keep you awake at night and often hangs your leg off the bed for temporary relief. Non-healing wounds or ulcers, typically on the toes, feet, or lower legs. These wounds are extremely difficult to heal due to lack of oxygen and nutrients. Gangrene, tissue death due to lack of blood supply. The affected area turns black, often accompanied by a foul odor. CLI is a limb-threatening condition that can lead to 2. Amputation. When gangrene or severe, non-healing ulcers develop and blood flow cannot be restored, amputation of the affected toe, foot, or even part of the leg becomes necessary to prevent the spread of infection and save the patient's life. This is a devastating consequence, leading to profound disability and a drastic reduction in quality of life. PAD is a leading cause of non-traumatic lower limb amputations. 3. Increased risk of heart attack and stroke. This is perhaps the most critical yet often overlooked danger of PAD. The atherosclerosis that causes PAD in your legs is a systemic disease. This means if you have narrowed arteries in your legs, it's highly likely you have narrowed arteries elsewhere in your body, including the coronary arteries leading to your heart and the carotid arteries leading to your brain. Heart attack. Plaque rupture in your coronary arteries can lead to a heart attack. Stroke. Plaque rupture or clots traveling from the carotid arteries to the brain can cause a stroke. In fact, individuals with PAD have a significantly higher risk of heart attack and stroke than those without PAD. It's a direct warning sign that your entire cardiovascular system is compromised. PAD isn't just a leg problem, it's a full-body alert. 4. Reduced quality of life. Even before severe complications, untreated PAD can severely diminish your quality of life. Chronic pain. Persistent pain, especially at night, disrupts sleep and daily activities. Limited mobility. Claudication makes walking difficult, limiting your independence and ability to participate in social activities, exercise, and daily chores. Social isolation. Inability to keep up with friends or engage in community events can lead to loneliness and depression. Anxiety and depression. Living with chronic pain, limited mobility, and the fear of complications can take a heavy toll on mental health. 5. Impaired wound healing and infection. Any injury to the feet or legs can become a serious problem. Poor blood flow means wounds heal slowly, making them highly susceptible to infection. An infection that would be minor in a healthy person can quickly become limb-threatening in someone with severe PAD. The progression of PAD is a stark reminder that early diagnosis and aggressive management are not just about relieving leg pain. They are about preserving your limbs, preventing life-threatening cardiovascular events, and maintaining your independence and quality of life. Don't wait for the symptoms to become unbearable. If those symptoms sound familiar, or if you have multiple risk factors, it's time to take proactive steps. Early diagnosis and appropriate treatment can slow PAD's progression, relieve symptoms, reduce your risk of serious complications, and significantly improve your quality of life. Seeking diagnosis. What to expect at the doctor's office. Don't delay. Schedule an appointment with your primary care physician. Be honest and detailed about your symptoms, especially the leg pain, numbness, and any issues with walking or nighttime discomfort. Your doctor will likely take a thorough medical history, review your risk factors, current medications, and symptoms. Perform a physical exam. Check pulses in your legs and feet, listen for arterial sounds, bruits, and look for skin changes or sores. Ankle brachial index. This is the most common and simple diagnostic test. It compares the blood pressure in your ankle to the blood pressure in your arm. A low ABI indicates narrowed arteries in your legs. It's a quick, painless, non-invasive test. Other tests if needed. Ultrasound. Duplex ultrasound. Uses sound waves to create images of blood vessels and measure blood flow, identifying blockages. Angiography. CT or MRA angiography. Uses X-rays or MRI with a contrast dye to visualize arteries and pinpoint the exact location and severity of blockages. This is usually reserved for cases where intervention is being considered. Treatment options. A multifaceted approach. Once diagnosed, PAD treatment focuses on two main goals. A. Managing symptoms and improving quality of life. B. Stopping the progression of atherosclerosis and reducing the risk of heart attack and stroke. Treatment typically involves a combination of lifestyle changes, medications, and sometimes medical procedures. A. Lifestyle modifications, cornerstone of treatment. These are critical for everyone with PAD, regardless of severity. Smoking cessation. If you smoke, quitting is the single most impactful step you can take. It dramatically slows PAD progression and reduces your cardiovascular risk. Structured exercise program. Often supervised by a physical therapist, this involves regular walking even if it initially causes pain. This trains your muscles to use oxygen more efficiently and can help new blood vessels form, collateral circulation. It's one of the most effective non-invasive treatments for claudication. Dietary changes. Adopt a heart-healthy diet low in saturated and trans fats, cholesterol, and sodium. Focus on fruits, vegetables, whole grains, and lean proteins. This helps manage cholesterol and blood pressure. Weight management. If you are overweight or obese, losing weight can significantly reduce strain on your cardiovascular system. B. Medications. Your doctor may prescribe medications to lower cholesterol. Statins are commonly used to reduce LDL, bad cholesterol, and slow plaque buildup. Manage blood pressure. Medications to keep blood pressure at a healthy level. Example, ACE inhibitors, ARBs. Control blood sugar. For diabetics, strict blood sugar control is essential to prevent further vessel damage. Prevent blood clots. Antiplatelet drugs like aspirin or clopidogrel, Plavix, are often prescribed to prevent clots from forming in narrowed arteries, reducing the risk of heart attack and stroke. Improve blood flow to legs. Cilostazol, Pletal, is a specific medication that can improve walking distance for people with claudication by dilating blood vessels. C. Revascularization procedures, for more severe cases. If lifestyle changes and medications aren't enough, or if PAD is severe, e.g. CLI, your doctor may recommend procedures to restore blood flow. Angioplasty and stenting. A balloon is inflated inside the narrowed artery to widen it, and sometimes a small mesh tube is left behind to keep it open. This is minimally invasive. Atherectomy. A catheter with a cutting device is used to remove plaque from the artery. Bypass surgery. In more severe cases, a graft, a vessel from another part of your body, or a synthetic tube is used to create a new path for blood to flow around a blocked artery. This is a major surgery. Taking action means being proactive, asking questions, and committing to a comprehensive treatment plan. It's about taking control of your health journey to ensure a better quality of life and a healthier future. Receiving a PAD diagnosis is not a life sentence, nor is it a sign of inevitable decline. With proper long-term management, you can significantly improve your symptoms, prevent disease progression, reduce your risk of cardiovascular events, and continue to live a full, active life. Living well with PAD is about consistent commitment to healthy habits and vigilant self-care. 1. Adherence to treatment plan. This is paramount. Stick to your prescribed medications, attend all follow-up appointments, and commit to the lifestyle changes. Remember, medications like statins and antiplatelet drugs are not just for your legs. They are protecting your heart and brain too. 2. Ongoing exercise and supervised programs. Don't stop exercising once symptoms improve. Regular physical activity, especially walking, remains one of the most effective ways to manage PAD. Supervised exercise programs can provide guidance and motivation, helping you walk further and with less pain. Even on days when your legs hurt, try to move gently. Consistency is key. 3. Meticulous foot care. Because PAD compromises blood flow to your feet, even minor injuries can become serious. 1. Inspect your feet daily. Look for cuts, blisters, sores, redness, swelling, or changes in skin color. Use a mirror if needed. 2. Wash your feet daily. With lukewarm water and mild soap, dry thoroughly, especially between the toes. 3. Moisturize. To prevent cracking, but avoid between the toes. 4. Trim toenails carefully. Cut straight across. If you have thick or ingrown nails, see a podiatrist. 5. Wear proper footwear. Well-fitting, protective shoes and seamless socks to prevent rubbing and blisters. 6. Never walk barefoot. Always wear shoes or slippers, even indoors. 7. See a podiatrist regularly, especially if you have diabetes or severe PAD. 4. Aggressive management of risk factors. Continue to diligently manage all your underlying risk factors. Blood pressure. Monitor regularly and ensure it's within your target range. Cholesterol. Adhere to statin therapy and a heart-healthy diet to keep cholesterol levels optimized. Blood sugar. For diabetics, strict control of blood glucose levels is vital to prevent further vascular damage. Smoking cessation reinforced. For former smokers, stay smoke-free. For current smokers, continue to seek support to quit. Weight management. Maintain a healthy weight through balanced diet and exercise. 5. Stay vigilant for worsening symptoms. Be aware of any changes or worsening of your symptoms. This includes increased pain during activity or at rest, new or worsening numbness or weakness, changes in skin color or temperature, any new sores or wounds on your feet or legs. Report these to your doctor immediately. These could signal a progression of PAD requiring further evaluation. 6. Hydration and healthy diet. Continue to emphasize a balanced, nutrient-rich diet and adequate hydration. These general health principles support your overall cardiovascular health and can help manage any other comorbidities. 7. Mental and emotional well-being. Living with a chronic condition like PAD can be challenging. Seek support if you experience anxiety, depression, or feelings of isolation. Connect with support groups, friends, and family. Engage in hobbies that bring you joy. Living well with PAD is about embracing a proactive, informed approach to your health. It's about understanding your condition, adhering to your treatment plan, and making consistent, healthy lifestyle choices. This commitment allows you to reclaim your mobility, protect your heart and brain, and continue to live a fulfilling life. That nagging leg pain at night, that fatigue during your walk, it's easy to dismiss it as just getting old or a minor ache. But as you've learned today, these whispers from your body can be critical alarms. Peripheral artery disease is a serious condition, often overlooked, but with alarming risks, from limb loss to life-threatening heart attack and stroke. You've now been empowered with vital knowledge: what PAD is, narrowed arteries in your legs reducing blood flow, The alarming symptoms, from claudication to rest pain and non-healing sores. The critical risk factors, smoking, diabetes, high blood pressure, cholesterol, age. The dangerous progression of untreated PAD, including critical limb ischemia and amputation. The multifaceted approach to diagnosis and treatment, ABI, lifestyle changes, medications, and potential procedures. And the long-term strategies for living well with PAD, focusing on adherence, exercise, and meticulous self-care. This isn't about fear, it's about knowledge. It's about empowering you to listen to your body, advocate for your health, and take proactive steps that can profoundly change your future. Don't let leg pain steal your mobility, your independence, or your quality of life. So, here's your crucial call to action. If you experience leg pain at night, cramping during walking, or any of the symptoms discussed, especially if you have risk factors, schedule an appointment with your doctor today. Don't wait. Discuss your concerns openly and specifically. Mention PAD. Ask about an ankle brachial index. It's simple, painless, and can provide critical information. If diagnosed, commit to your treatment plan and lifestyle changes. Be vigilant with foot care. And most importantly, share this message. This information is life-changing. Share this video with your family, your friends, anyone who might be experiencing these subtle, often ignored symptoms. Your legs carry you through life. Your heart keeps you going. Protect them both.